Everybody, you think it's a waters?
Yes.
Yes.
Why?
Because the orbits are kind of more switched.
Yeah, the orbits are not detailed, they're distorted. What about the maxillary sinuses?
The lower half is way below.
Yeah, the petrous ridges are way below the maxillary sinus, so that's another cue that it's a waters. Alright, so for question number 1, skull position, it's a waters. Number 2, your baseline, we all did this one, it's your MML, mental meatal line, and that's gonna be perpendicular to your medium, so it's your MML. How is the OML placed for this position? What angle does it form?
37 degrees.
Correct, 37 degrees. What anatomy is of primary interest for the waters? What can you see? Maxillary sinus and your orbits. Why do we normally shoot a waters? Do you guys know? Have you guys shot a waters before? Any of you? Okay, so normally when the radiologist asks us to do a waters view, the reason we're doing them is because some of these patients are welders. So because they work with metal particles, some of those tiny, it's almost sand-like pieces of metal go into their eyes. So before they have to go and get an MRI, they have to be cleared for metal particles. So we shoot a waters, look at their orbits, and they look for any metal fragments. If there are metal fragments, they'll be able to see the specks. And if they have them, then they're not cleared to get an MRI. Because if you get an MRI, metal, yeah, those are gonna shoot out of their eyes. You don't want them to be blind. Okay. CR, enter and exit. Yeah, a campion, correct. And then primary evaluation criteria for this radiograph is basically that the petrous ridges are below the maxillary sinus. All right, image 2, we confirmed that it is what? Modified waters. What's different from the waters and the modified? Look at the orbits. So theirs is lip meatal. That means the orbits are closer to the image receptor and there's less distortion. You could perfectly see the lower margin of the orbits. They're super detailed. Also, the petrous ridges are gonna be in the lower half of the maxillary sinus. That's how you also know that it's a modified. So this is not an excellent picture of a modified, but these petrous ridges should be about here. And that's how you know it's a modified. The petrous ridges are gonna be in half on the lower half of the maxillary sinus. Your orbits look larger, they're detailed. Also, anything else? It's not chin, it's not as far back. It's gonna be lip meatal. That's why the orbits are not distorted, but I already said that. All right, so for number 7, positions, modified waters. Number 8, your baseline is LML, lip meatal line. OML is placed at how many degrees?
55.
OML forms 55-degree angle, correct. And it's gonna exit the same as the waters. You're a campion. Primary evaluation, petrous ridges shown into lower half of maxillary sinus. The anatomy best demonstrated, number 12, are gonna be your orbital floors. And what type of pathology is best demonstrated in the modified waters?
Possible orbital fracture of foreign bodies.
Correct. Blowout fracture and foreign bodies. You guys ready for number 3?
Yep.
What was that one?
Lateral nasal bone.
Correct. Lateral nasal bone. Baseline is gonna be your
IPL.
interpupillary line, the IPL, and your IOML, infraorbital margin line. So IPL and IOML. And your CR enters where?
Half an inch inferior to the median.
Correct. Which is common sense because it's your nose is right here, so half an inch below the nasion. Don't overthink it. Alright, image number 4, what is it?
Reese.
Yeah, I know it kind of threw you off because it showed the whole skull, but it is the Reese method. And what are the baselines? So it's gonna be AML, your acanthomeatal meatal line, and your 3-point method. So it's chin, cheek, and nose are on the IR. You guys got all that? Alright, number 20. Mid-sagittal plane forms 50-degree angle to the table, and it's gonna be 37 degrees perpendicular. What is the primary evaluation criteria for this image for 21?
Optic frame and everything.
Yes. So the optic foramen is seen in the outer lower quadrant. I'm sure they're gonna test you on that.
He said in the video.
Mm-hmm.
No, but I remember it when I was a student. What anatomy is of interest? And I'm sure you guys are gonna know where the picture is, but I know I got tested on that for sure. What anatomy is of interest on this image? Correct. So the lateral margins of the orbits and the optic foramen are demonstrated. And number 5. Oh wait, another name for this position, 23.
Parietal
Yep,
oblique.
parietal orbital oblique. And for image number 5, what is this?
Lateral fishable.
Correct. Where does the CR enter? Correct. The most prominent part of your face, your zygoma. Which side of interest?
Left side.
So the side of interest is gonna be the affected side. The affected side is gonna be closest to the IR. Because you can take lateral facial bones, but it could be the right or it could be the left.
I thought it meant on that.
Oh, no.
Specifically.
Oh, well, yeah, that makes sense.
Donna.
You're right, that is the right, but also it's usually the affected side. They're not gonna take a picture of the side that's okay.
But is that the right side or the left side?
No, you're correct, it's the right side.
Wait, that's the right side? Oh.
But it's the affected side. The affected side is the side you're gonna shoot. That's gonna be closest to the IR, but it is the right side, you're correct.
That's right?
Maybe that was left.
I thought it was left side.
But they're like this.
On the left side.
Left.
It's on your left.
Oh, yeah, I'm watching my left side.
I was like,
Sorry. Just ignore me right now. You're right.
Because you're like, yeah, you guys are right, on the right side.
Is that what you're saying, right? Yeah, you guys are right, it is the left.
Okay.
We're left side, but for.
It's the affected side,
For-
but yeah,
for the
that
questions
image,
here, affected
it's
side.
the left, you're correct, yeah, sorry.
Okay.
See, you can question me, it's fine. Other than that, I think that's it. Alright, if you guys are done.